Haniya, Stephanie,
I'm Joy.
Helen, and we're going to be going over manual CPT and postural drainage.
Manual CPT and postural drainage is a technique used for airway clearance. The RT's role will be to apply these techniques, listen to the patient's breath sounds, monitor the patient's O2, section if needed, and record the findings. The equipment that's going to be needed for both the techniques is going to be precursor cups or a makeshift precursor cup, a stethoscope, O2 monitor, suction catheter or suction bulb, pillow, blanket, chair, or a bed. For manual CPT, we're going to demonstrate chest percussion. The clapping of the chest gives off vibrations to the airways that will help to loosen secretions and or mucus. Postural drainage is a technique that involves the use of gravity to drain secretions and or mucus by positioning the patient in different lying or sitting positions and applying the CPT.
So the indications, perform the procedure to the stimulation, the productive cough, and improve the aeration in patients with the disorder that result in the mucus production. The first one is pneumonia. The second one is acute atelectasis. The third one is bronchiolitis. The third one is cystic fibrosis.
About contraindications, some healthcare providers would refrain from performing this procedure in patients with the following contraindications, such as active hemoptysis or coagulopathy, and this is characterized by a platelet count of less than 50,000. And you should also exercise caution in patients with rib fractures or metastasis, and an active pulmonary embolism, an untreated pneumothorax, a bone density deficiency, or recent spinal injury or surgery.
Okay, we're gonna go ahead and get started on the demo portion. Before we start with the actual percussion, we're gonna go ahead and listen to the patient's lungs. We're gonna listen for any wheezing, crackles, or unequal aeration. We're going to go ahead and assess the patient's ability to be placed in the different postural drainage positions. There might be some like IVs and lines, so we just want to make sure that we don't get in the way of all of that. You are also allowed to make modifications if the baby feels more comfortable in the mother's arms and your arms on the bed. They can also modify that. The oxygen level might drop in a specific position, so it's also important to monitor vitals and just overall assessment of the patient while we're performing the procedure. After explaining the procedure to the patient and the family, we're going to go ahead and get started. So there's usually around like 6 different positions done for postural drainage, but we're just going to go ahead and modify it and just do around 2 or 3 different positions. And we go ahead and percuss. It's usually done for 1 to 2 minutes. I'm going to go ahead and use the makeshift one since I feel like there's more air trapping in the mask. So we're going to start with the anterior segment of the upper lobe. We're going to start percussing between the limbal line and the clavicle line on the right side and on the left side. So as I begin doing this, I'm going to look at the baby for any color or oxygen changes. I'm just going to keep doing this for about 1 to 2 minutes. And then we're going to go ahead and switch to the other side after the 1 to 2 minutes. It is also patient dependent. If you want to do some vibrations, if the secretions are extra thick, or if the gravity does not help mobilize them. This is often also soothing for the patient. So now we're gonna go ahead and do the second position. We're gonna move on to the posterior segments of the upper lobe, and you're gonna go ahead and move the baby. We're gonna make sure that the head of the bed is elevated, and we're gonna percuss between the spine and the axilla. Again, we're gonna look for any oxygen or color changes. If the patient needs suctioning, we can go ahead and perform that at this time. Last position, we're going to rotate the baby over, and we're going to go ahead and percuss the bases of the lower lobes. We're going to make sure not to overlie the spine or go near the kidneys. After the procedure is done, we're going to go ahead and reassess the patient. We're going to monitor vitals, any color change or oxygen change, and we're also going to go ahead and suction.